November 9, 2017, 9:54 p.m. EST. Last updated November 10, 2017, 7:23 a.m. EST. In cool, clinical language, it's known as unintended intraoperative awareness with recall waking during surgery, unable to speak or move. It's estimated that as many as 1 or 2 in every 1,000 people who receive general anesthesia experiences it. People have described waking with their eyes taped shut and hearing surgeons say, "Cut deeper," or hands moving instruments inside their bodies and trying desperately to signal with a shrug, a twitch that they're conscious. Now, researchers are trying to reduce the rare but real nightmare phenomenon by applying what they are learning from another group of patients who appear to lack consciousness but who are, in fact, aware, people misdiagnosed as being in a vegetative state. The goal, they say, is to minimize the harm to people of surgical awareness and find better ways to detect conscious thought in people believed to be entirely oblivious. Currently, no monitor exists that can rule awareness out in 100% of cases. Some 20,000 to 40,000 people experience accidental awareness a year in the United States alone, the research team, which includes renowned Western University neuroscientist Adrian Owen, writes in a recent issue of the journal Anesthesia and Analgesia. Sometimes the anesthetist simply gives too little anesthesia by error. Some patients are more resistant to the drugs, and don't respond in normal ways. The patient had no way of indicating something was wrong. When it happens, people report hearing voices or the sound of equipment, feeling breathing tubes down their throat and, sometimes, searing pain. Many experience vivid flashbacks, nightmares and post-traumatic stress, and avoid anything that reminds them of the trauma, even lying flat. In May, a Toronto woman who woke during surgery because of an anesthetist's negligence and felt surgeons ripping me apart won Canada's first malpractice ruling involving accidental awareness. Frozen by paralytic drugs, the patient had no way of indicating something was wrong, the judge found. It's a similar scenario for the 13,000 to 53,000 people in the U.S. in a vegetative state, people that show no signs of awareness and are behaviorally non-responsive. Owen and his lab have for years been using brain scans to communicate with people considered all but dead. In 2011, they reported that as many as 19% of vegetative patients show signs of covered consciousness when their brain waves are measured using a cheap, portable bedside EEG. Of 16 vegetative patients in the study, 3 repeatedly showed appropriate brain activity responses when asked to imagine moving their right hand and wiggling their toes. More recently, Western neuroscientists led by Lorena Nacey, now a professor of psychology at Trinity College Dublin, used a short Alfred Hitchcock movie Bang! You're Dead to detect consciousness in a man who had been in a vegetative state for 16 years. While inside a special MRI scanner, the 34-year-old showed similar patterns of brain activity with peaks and dips at identical points of the movie as healthy volunteers shown the same 8-minute clip. Nacey and colleague Mackenzie Graham are now exploring how to adapt these new techniques to detect when surgery patients have awakened.